Welcome to Tomorrow Ready, quick LTC insights from JMA, a series where we provide you, employee benefits professionals, with news, tools, and views about group long-term care insurance planning.
Welcome back to Tomorrow Ready. I'm Ivette Garzon. I'm here with Steve Cain. In today's discussion, we're going to tackle consumer misconceptions. So let's just hop right into it. Steve, why are people not buying long-term care?
You know, I might be crazy, but I don't think it's because of the money or the premiums that we pay for this coverage. I know that sounds nuts.
I'm going to ask, are you feeling okay? Because that sounds insane. What do you mean by that?
Well, look, money's always going to be a thing, right? It's always going to be an issue. Can I afford this coverage? But we're just not logical creatures. I can provide you with stacks of data, statistics around the probability of needing long-term care, cost of care surveys, and the increases on the cost of care, all that good stuff. But people simply don't think it's going to happen to them. And we've learned in behavioral finance that we're just not logical. And about 70% of the decisions that we make are emotional. And then, the 30%, might be the engineers, might be the folks that are fact-based. Give me all the information, I'll make a reasoned choice. But I think a lot of times the facts just reinforce how we feel.
No, I think that's really true. I've talked to a ton of people, and the first thing that I hear when I talk to them about long-term care is, doesn't Medicare cover that?
Right. And I'll start and say Medicare is a great program. It is wildly popular. However, it wasn't designed to pay for long-term care support and services. Only about 10% of what Medicare covers is long-term care. But 60% of the country thinks that Medicare is going to take care of them. So we've got a lot of work to do in terms of educating people what's covered and what's not. But essentially, Medicare was rehabilitative in nature, acute care versus extended care.
Yeah, that's a staggering statistic. And speaking of government programs, I've noticed a lot of employers and employees are kind of in this wait and see kind of mode to see if another state will create a public LTC program like Washington.
Yeah, and I'm not trying to be, self-serving when I say this, but like that wait and see mode's not a great idea. And why do I say that? Look, more and more states will continue to explore these public long-term care programs. That's a given. Somebody told me that aging is a bipartisan issue, and I agree. Most recently, we saw Massachusetts come out with a study, and they'll likely form some type of task force or commission to study this even deeper. But how long is it going to take for a law to be passed in a particular state, and for a program to be implemented? And then what does the long-term care benefit actually look like? I don't know how long that's going to take. So we could be talking about, let's wait years in which people get a little bit older, so meaning the price goes up for those folks.
Yeah.
And then we don't know whether or not, how these are going to coordinate yet with private long-term care insurance. So I just think if you believe in planning for long-term care, do it sooner than later.
No, I think that's 100% correct. So we've talked about denial. We've debunked Medicare. We've talked about state programs, but now I'm going to take it into a personal aspect, one that even me myself have heard all the time from my mom, which is, I don't need long-term care insurance. My kids are going to take care of me. How do you answer this?
Well, first of all, that's so sweet of you, taking care of mom. That's so nice of you. But how do I answer it? I pick up the phone and say, can we call them? Do they know that they're your plan? And I'm joking around, but the bottom line is there are significant consequences to having family members care for you. It's what we do.
Yeah.
It's what I did with mom, but it was hard. It still is hard. I use a word with everybody. It's consuming. It can eat up your energy, your time, your money, your emotions. And so I would just suggest that, having a plan for long-term care that's not family members enables them to love you and be with you, but not be the primary caregivers. Or if they are going to care for you, having a plan outside of them enables them to care for you longer and better because they've got resources and support.
Yeah, no, that is 100%. relatable and true. So here are my takeaways, right? This is not an easy decision for anyone unless someone has had firsthand experience. And we at JMA, along with our broker partners, we really have our work cut out for us in making sure that we're educating employees on this big issue and how these products can help families.
Amen.
So if you would like more information or need help beginning this conversation with your client, email us at the email below, connect with us on YouTube and LinkedIn, and we will see you next time on Tomorrow Ready.
Thanks.